Staggering numbers show the state of Utah lags way behind when it comes to breast cancer prevention.
We're last in the country for the number of women over the age of 40 with insurance who get an annual screening mammogram. Joining us live on the KSL Newsline is the director of Intermountain Medical Center's Breast Care Center, Dr. Brett Parkinson. Good morning, doctor.
Good morning.
Now, this is kind of a surprising statistic because we're talking about women over the age of 40 with insurance.
Yes, it's surprising because we consider ourselves fairly healthy in Utah, and we are. However, our screening rate is abysmally low, and as you indicated, we are 50th in the nation, meaning that of eligible women who have insurance, only 64% actually have had a mammogram, not in the last year, but in the last 2 years.
Why?
Well, that's the question. Since Utahns are usually healthy, we find it surprising that this is so. But in Utah, we have larger families, so women have more people to care for. In addition, most women in Utah work, so they're stretched in many directions. They have large families. They're caring for children. Sometimes they're caring for parents, and sometimes they put themselves last. Many women that we have had come through the breast center say that they have been distracted by caring for others, and so they will often neglect their own health care. So our campaign is to get women to look out for themselves first.
Now, there have also been some confusing reports in the last year or so about the frequency and effectiveness of these kinds of screenings. Do you think that might play into this a little bit?
Well, that may play into it minimally because we've actually noticed a slight uptick in the last year in the number of women having screening mammograms. But the recommendations are that women begin annual screening at the age of 40, and they continue to do so every year after that, as long as they are healthy. The U.S. Task Force came out 2 years ago indicating that women should not begin screening until age 50, and then thereafter only every other year. But the science behind that was shaky, so shaky, in fact, that Kathleen Sebelius, Secretary of Health and Human Resources, disavowed that and indicated that women should go with the old American Cancer Society guidelines.
And isn't Sherry Dew going to talk about this subject? Is it tomorrow, doctor? And I know she doesn't talk about her battle with breast cancer very often, but she's going to talk about it tomorrow, isn't she?
She is. Sherry has decided to go public with her experience, and I think it will be helpful for many women in this valley to hear that. She was diagnosed about 6 years ago, and she also has other family members with breast cancer, and she's going to talk about her experience as well as that of others. I think what's important to remember is that if you have 1,000 women out there, 4 of them will have breast cancer and not know it. So if you have a listening audience of 20 or 30,000 people, imagine the number of women that actually have breast cancer now without knowing it. And the only way to know is to have a screening mammogram. They'll eventually find out, and it's better that they find out when it's small.
Well, that is a great reminder. And again, we are last in the nation with women over 40 who have insurance getting these screenings.
Okay, doctor, I scheduled my appointment yesterday. I'm coming to your facility in 10 days.
Excellent. And I hope that there are other listeners out there who will schedule their appointments as well. It may be the appointment that saves their life.
I'm sure that's true. Thank you so much for your time this morning.